All right, thank you all for joining the Alport Syndrome Foundation's Ask the Expert series on diet and nutrition. We'd like to say thank you to Global Genes for the funding to make this series possible. Today, I would like to introduce Esther Berenhaut, who is a registered dietitian with the Children's Hospital Los Angeles, and she is going to be speaking to us about how diet and lifestyle can impact those with kidney disease, specifically Alport syndrome. We are very grateful to her for spending her time with us today to help answer questions. She will be presenting her piece, and then if you have any questions, you are welcome to ask them in the chat section online. I have muted all lines to prevent distractions and noises. Once she has answered all of the questions that have been asked online, then those of you who are on the phone and unable to ask questions in the chat section will be able to do so when I unmute the lines. So without further ado, thank you so much, Esther, and I will allow you to take it from here.
Thank you so much, Gina, and thank you for giving me the opportunity to share some knowledge on the renal diet. My objectives today is to really talk about not so much specifically Alport syndrome. I will discuss it at the beginning of the talk, but my focus today really is on the stages of kidney disease and how the role of the diet plays into each of the stages. Specifically, we're going to talk about salt or sodium in the diet, potassium and phosphorus, and how that relates to renal function and at what points within the progressive stages of kidney disease you may need to make changes in your diet. And we're also going to review the sources of salt, potassium, and phosphorus in the diet, how to manage these in a busy lifestyle in order to maintain proper nutrition, because it can be challenging. As with any type of special diet need, the world doesn't always respond to our needs the way we would like them to, so we have to have tools in our kit, as if you want to call it that. We have to have tools in order to really take care of ourselves out there. So when we talk about this type of kidney disease in Alport syndrome, it is referred to as thin basement membrane disease. And what this does is allows for blood and protein to escape into the urine. And over time, this can cause scarring of the kidneys and can lead into progressive kidney damage. Most commonly in our institution, we see them in the X-linked in males. The research tells us that the majority of males can go into renal failure by the age of 25. We do see this in younger men. My youngest patients, I would say, is about 16 years old, and we've seen them in 17 and 18-year-olds as well. As far as prevention goes, the current preventative treatments include ACE inhibitors, which is found to really protect the kidney and prevent scarring. That's mode one. Heart-healthy lifestyle. So watching your sodium in your diet, making sure that you're eating healthy fats, and watching your sugar intake will help you to maintain your kidney function. All of that contributes to maintaining a healthy weight and healthy lifestyle, including exercising regularly, avoiding smoking, avoiding excess alcohol, and maintaining normal blood pressure. All of these are very important in maintaining your kidney function and preventing the progression of kidney disease. So when we talk about kidney disease, we talk about the stages of kidney disease. So somebody with stage 1 kidney disease actually has normal function. So we're looking at GFR, or glomerular filtration rate, of greater than 90. Stage 2 goes below 90, is between 60 and 90. Stage 3 is split up into an A and B, a mild to moderate reduction and a moderate to severe reduction in GFR, stage 4 being severe and stage 5 being end stage. So when we talk about stage 1 and 2 in terms of diet, we don't see a lot of symptoms in those stages when it comes to how people feel. Usually people don't feel any different. A lot of times when we look at blood levels, specifically things like anemia, calcium, phosphorus, potassium, we don't always see a lot of increases. And typically, as long as people are healthy, we don't encourage a change in the diet. We encourage the healthy diet. Sometimes the only thing that we might see in maybe stage 2 or 3, we can see increased potassium levels because ACE inhibitors do tend to hold on to potassium in your blood. Sometimes it can be significant, and sometimes it sort of hangs around just slightly level higher than where we want it. So you really need to discuss your potassium levels when you use ACE inhibitors with your doctors, and if you need to see a dietitian, if you need to reduce your potassium in your diet, then we really encourage that. And that's stage 1, stage 2. Stage 3, A or B, sometimes we can see changes in energy levels, which can be related to anemia. Anemia doesn't always, let me repeat. Typically with kidney disease, anemias are treated with iron and other medications. It doesn't typically respond to diet changes. Some high iron foods can be increased, but typically the anemia comes from the decreasing hormones in the kidney. And sometimes we can see changes in phosphorus levels. They can be elevated. Sometimes calcium levels can begin to drop. And as a result of the lower calcium, you can see an increase in something called the parathyroid hormone. That typically starts in late stage 2, stage 3. And typically the calcium, phosphorus, parathyroid, these change in response in a decrease in active vitamin D levels. And we're going to go over that a little later in the talk. The long-term effects of this particular section can, the calcium, phosphorus, and PTH, it can affect your bone health and your cardiovascular health, so they are important to stay on top of. When we talk about stage 4 kidney disease, we are progressing. Sometimes we can see increased fatigue, and that can be related to the level of nitrogen or BUN that's in your bloodstream. Sometimes you can get, I'm calling it bad breath, but there is a specific smell that is related in your breath that is related to what we call uremia or the high BUN. Sometimes you can see an increase in nausea or food tasting different as a result of this. Sometimes your appetite can go down, so maintaining good nutrition when your appetite isn't very good can be a problem. Sometimes you see a decrease in urination, and sometimes you don't. At this point, typically in my experience, I don't see it, but it can happen. Higher potassium levels are more likely. Basically, in this stage, we tend to monitor labs a little bit more closely, and if there are changes in potassium levels, then we institute diet changes at this point. By level 5 ESRD, this implies basically a loss of kidney function, and you're at least considering dialysis at this point. not everybody at stage 5 goes on to dialysis right away. Some people, if they're urinating well still, they can avoid dialysis a little longer. But if urine output does start to decrease and you see excess swelling, dialysis usually becomes necessary at this point. You can see an increase in itching, and if your phosphorus levels are high in your blood, that will tend to lead to itching. You can have a loss of concentration or increasing fatigue, which is again related to the excess nitrogen in your blood. You can also see an increased darker tone to your skin with the higher nitrogen level. So let's talk about each of the things that we kind of alluded to earlier. So when we talk, sodium, that's something that is ubiquitous to the fluids in your blood. So it's mostly in body fluids. So it's going to be in blood, it's going to be in lymph, and it's going to be in saliva, other body fluids. Sodium is necessary in order for muscle contraction, for nerve conduction, and it helps maintain fluid balance, so it helps maintain your blood pressure. So we do need to have some sodium in the diet. If we have too much sodium in the diet, it can lead to an increase of serum sodium, but typically what your body does is, as a result of the increased sodium, it will increase your thirst, so you'll want to drink more. That will in turn lead to increase in your extracellular volume. That will put a strain on your heart, and will also it will increase your blood pressure. So all of that, and that's because of the high fluid content in your vessels, and it's putting pressure on your vessels. So if you are in stage 5 or end-stage renal disease and you have decrease in urination, you typically have this increased extracellular fluid volume, and that's going to be independent of whether you drink salt or eat a lot of salt or not. So you can see increased swelling, you can see increased weight related to fluid overload, and at this point you will see an increased need to limit sodium. If you've been watching your diet already, hopefully you're already on, you've been watching your sodium all along, and then the decrease in sodium won't be as difficult to try to achieve. But when you're having issues with urination, limiting your salt becomes really important, because you really need to limit your fluids at this point too. And the more salt you take in, the thirstier you get. So let's talk about potassium. So sodium is an extracellular fluid, so meaning it's outside of the cell, mostly in the body fluids. Potassium, on the other hand, is a major electrolyte that is in your cells. And what potassium does is control the electrical conductivity of the heart especially, and other muscles. It helps to control acid and base balance, and it also helps to control the blood pressure. So it actually helps the contraction of your smooth muscles is within the vessels themselves. So in a normal healthy person, a higher potassium diet will help blood pressure. But if you have to watch your potassium, it can become challenging. So in end-stage renal disease, hyperkalemia, or high potassium levels, become much more common, especially when you lose urine output. So your normal range of potassium is between 3.5 and 5.0 milligrams per deciliter. We call hyperkalemia as anything really above 5 milligrams per deciliter. So mild hyperkalemia will be between 5.1 and 6 milligrams. Moderate is between 6 and 7, and severe will be greater than 7. And the most important reason we watch potassium or high potassium levels is because it affects the heart rhythm. It can cause pretty significant changes on an EKG, and if it gets high enough, it can actually lead to death. So we're talking about very severe levels in the 8s and 9s, but it can be a very dangerous thing. Typically, moderate levels of hyperkalemia we can treat with diet. There are some additional medications depending on severity. So if people are having a hard time with controlling their potassium levels with diet alone, there are some medications that can help. One is called K-Exolate, and that's a very old drug. It also delivers a lot of sodium along with it. It tastes quite gnarly too, so if we can avoid having to use medication, we do. There is a new medication out there called Veltasa, which also works to bring down potassium levels in the blood. It is a more expensive drug, and it's just come out on the market within the last year. It does tend to work at least as good as K-Exolate, a little better than the K-Exolate, but it's, again, if we can avoid using these medications, there is a sodium load that comes along with Veltasa as well. And now we can talk about phosphorus. So phosphorus is a component of bone and teeth. It is a component of cell membranes, so it actually is part of your cell walls. It's part of your skin. It's required for making proteins. It's required for growth and tissue repair. It actually is required in your body to make energy. If you don't get enough phosphorus, you can't make energy. So this is a necessary element in your diet. Typically, in kidney disease, levels are high. It's very rare to actually see low levels of phosphorus within people that have chronic kidney disease. And typically, they're controlled with diet and meds. Phosphorus is, we can't really talk about phosphorus without talking about the mineral bone disorder that's associated with chronic kidney disease. And basically, this is multifactorial. So controlling phosphorus is part of a whole other series of chemicals that we have to control. So within this, we're watching calcium levels, we're watching phosphorus, we're watching parathyroid hormone. Vitamin D metabolism is affected in chronic kidney disease. How bone is made is affected in all of this. If you are a young person and you're still growing, it can put a damper on growth. And it can also cause, if levels are abnormal, it can cause a vascular or other soft tissue calcification. So you can develop calcifications within your vessels if your mineral bone disorder is out of whack, shall we say. So this is a schematic of what's supposed to happen in your bone in bone health. So it starts in your skin, and as a result of your diet and or sun, your body actually makes vitamin D3. And there's a series of enzymes that make the vitamin D3 from actually a chemical called 7-dehydrocholesterol. So you can see that we have cholesterol as a precursor to vitamin D. So you actually need some cholesterol in your diet too. And as far as dietary sources of vitamin D, fortified milk is probably the best source. Sometimes you can find it in orange juice. Salmon or other fatty fishes, vitamin supplements are probably the most common form, and anybody who is still old school who takes cod liver oil, that is an extremely good source of vitamin D, although who really wants to drink cod liver oil? So from the vitamin D3, your liver converts vitamin D3 into a chemical called 25-hydroxyvitamin D. And the last step in this is your kidney, which has an enzyme called alpha hydroxylase as well, and it converts it to active vitamin D, the 125 G. And that actually helps to absorb calcium and phosphorus from your intestines and can help deposit it in your bone. And then there is an ongoing balance of maintaining blood levels of calcium and phosphorus. So if we look here at PTH, PTH is your parathyroid hormone, and that actually can help mobilize calcium from your intestine, or excuse me, from your bone, to also help maintain levels. So that's kind of what a normal scheme looks like. Oops. So we talked about we kind of went through these steps already. So the 125 version of vitamin D helps your body to absorb calcium. When you have chronic kidney disease, your body can't make the 125 vitamin D, and you can become hypocalcemic. So your serum calcium can become low, and that can be problematic. People with chronic kidney disease also cannot excrete phosphorus as well from the kidneys, so your phosphorus levels tend to become higher. And both of these, the low calcium and the high phosphorus, stimulate your parathyroid hormone, which actually breaks down your bone to help to maintain these levels. The high phosphate level also stimulates another hormone called what we call FGF23, which actually tries to act on your kidney to get rid of the extra phosphate, but because your kidney isn't working, that hormone tends to stay high and can be problematic as well, because it will the FGF23 tries to lower the production of your vitamin D3, which is kind of like a double whammy. So you're already making less, and the FGF23 is acting on that. So as long as your phosphorus levels remain high, this FGF23 stays high in your blood as well, and that can lessen the therapy or lessen the amount of active vitamin D that your body can make as well. So you see in this slide, you can see with the laboratory abnormalities, you can have this abnormal bone turnover, so you can have issues with mineralization of the bone, you can lose bone volume, you would have issues with linear growth, and you can have lower strength. And the calcium and phosphorus can actually deposit in your soft tissues. So that can be a problem as well, because that will actually work to harden your arteries and your resistance, the resistance of your blood vessel, and that feeds into hypertension. So how do we control this piece? This is probably one of the more challenging pieces of diet and renal disease. So you need diet therapy and you need medication therapy. Active vitamin D analogs, something called calcitriol, or in our clinic we use something called Zemplar. This is basically the 125 vitamin D taken as an oral pill or an IV, and that will help to maintain your calcium levels in your blood. But also, these cause an increase in serum phosphate. So in addition to a low phosphate diet, we use these phosphate binders, and these are usually taken with meals to help prevent the absorption of phosphorus in foods. So there's 3 different classes of these particular medications. One is calcium-based, and there's 2 different versions typically of this. Tums is commonly used, taken with meals to help find phosphate. Calcium acetate, or Phosphlo, is the brand name for this, and this can also be taken with meals. And because they're calcium-based, sometimes we see a lot of high blood calcium levels, and a lot of physicians have, as a result of this, have gone to the lower or the non-calcium-based binders. One of the more common ones that we use in our clinic here is called sevelamer carbonate, or Renvela. This works as well as the calcium-based binders. Plus, it has a little added bonus of can decrease cholesterol as well. But again, these are taken with food in order to bind the phosphate. Lanthanum carbonate, or Phosrenol, is another non-calcium-based binder. This is a chewable pill. It's rather large. And it can be difficult, certainly for some of our older kids that we've used it on, to chew these. They're a little bit more difficult to take. Sevelamer actually comes in a tablet or a powder, so it's usable for young kids. And then in the last 2 years or so, we've had this new class of phosphate binder that are iron-based. And if you have anemia, this can actually, in one case of these medications, the ferric citrate, or Auryxia, actually has been proven to increase iron levels in your blood. So you kind of get a bonus along with phosphate binding. You get some improvement in your iron stores, which is a great thing. The other one of these, I'm not going to say this really long term. I'll just call it Velphoro, and this is another chewable product, and it doesn't as readily absorb iron into your blood, but basically it is a very strong binder and can work very well, again, as a non-calcium-based binder. So let's talk about the diet as a whole. So when we talk about the renal diet in adults, what are we talking about? So we're talking about a triple threat. We're talking about a low sodium diet, a low potassium diet, and a low phosphate diet, typically. Low sodium, again, to help control blood pressure, to maintain thirst, and to prevent a lot of excessive fluid intake. Low potassium diet, we're looking at about 2,000 milligrams a day. The typical person, the recommendation for potassium is actually more like 45 to 5,000 milligrams a day. So this is less than half of what a regular person should be taking in the course of the day. And again, this is to control hyperkalemia in the blood. Some people need lower levels. Some people can do a little higher, again, depending on urine output. Low phosphorus diets, again, are to help to prevent bone loss and to prevent vascular calcification. So as far as sodium in foods, the rule of thumb is the fresher the food you're eating, the less sodium it's going to have. So again, if we go back to controlling to a heart-healthy lifestyle, eating fresh fruits, fresh vegetables, eating fresh meats, fish, eating whole grains, they're going to have lower amounts of sodium in them. Fresh frozen foods will also have a lower amount of sodium as well. So when you're buying frozen products, you want to buy frozen green beans, not the stuff with the butter sauce or the cheese sauce added to it. One thing that you want to watch for if you're buying frozen meats particularly is I have noticed that with some frozen chicken parts, they actually have they may have preservatives in them. And I have seen some with sodium phosphate or sodium benzoate. So you want to be careful when you're buying some frozen meats. Make sure you read them, read the labels. As far as canned foods, they're typically higher in sodium unless you see that there are no salt. They have no salt added. So as far as what we just call a low sodium food, something that is packaged, any serving that is less than 150 milligrams per serving, we consider low sodium. A moderate sodium food is going to have between 150 and 400 milligrams per serving, and a high sodium food is going to be greater than 400 milligrams per serving. So on our example here, we have sodium here as a moderate sodium food. And when you're dealing with, if your goal is to have 2,000 milligrams, you want to have, again, as low a sodium intake as you can. So this would be a moderate sodium food. So you want to, be careful on how often you use this type of product. And then we'll talk about potassium foods. And when we talk about potassium in food, for the most part, we're talking about fruits and vegetables. You can find potassium in other sources, but as far as limiting your potassium, you still want to eat fresh fruits and vegetables because you still want to maintain your heart health. So here is a quick, short list of some of the fruits and vegetables that are lower in potassium and helpful on a renal diet. So we can see berries, grapes, watermelon, raspberries. We've got some good high antioxidant containing fruits. Similarly, carrots, green beans, cauliflower, again, good high antioxidant containing vegetables here. So with regards to high potassium foods, we need to avoid foods that probably have greater than 200 milligrams per serving. And many fruits and vegetables are high in potassium. Again, I've included a short list of fruits and vegetables. There are resources online that you can find, and I'll go into that in a little bit. Most people don't think of dairy foods as being high in potassium, but they can deliver quite a decent potassium loads, especially fluid milk and yogurt. Nuts and seeds can be high in potassium, and chocolate, unfortunately, can be quite high in potassium. Again, here is a short list of the fruits and of the vegetables that are high in potassium. Now, having said that, there are ways we can reduce the potassium in vegetables, especially for potatoes and sweet potatoes. This is quite a common method of reducing potassium. We actually in the business call this dialyzing our vegetables. So what we do is you take the potato and you slice it into it says 1/8 inch thick, but you can also cube them. And because the more surface area that comes into contact with the vegetable, the more potassium you can leach out. You rinse them in warm water for a few seconds. We soak a minimum of 2 hours in warm water, and then you want to use a lot of water because you want to get as much, as much water around the vegetable as you can. If you're soaking for a long time, you want to change the water at least every 4 hours. And then you make sure you dump the water and rinse when you're done. And then again, when you cook the vegetable, you're going to want to cook it with a lot of water because again, when you cook vegetables, you're going to reduce the potassium even further. Now, for example, if we take the average potato, which may have between 700 and 900 milligrams of potassium, when we're done with this process and the boiling, you're taking a 900 milligram product and you're turning it into a 200 or 300 milligram product. Now you still have 200 or 300 milligrams in there, but again, it's much lower than dealing with 900 because that's almost half the potassium that you would take in a day. So, so this is a very good method. And we used to, back in the day when my dad was on dialysis, we used to do this all the time for him, and it really helped out. Let's talk about phosphorus. So when we think phosphorus, the highest amount of phosphorus is going to be in dairy foods. And with my teenagers, I'm always constantly talking to them about watching their dairy, especially cheese, because they love pizza and quesadillas and all of that kind of cheesy stuff. And it's really hard to get them off it because there's a lot of peer pressure around. It's like, yeah, come out and eat cheeseburgers and Mexican food. It's lots of cheese. So it's, for the most part, if you think of a glass of milk, it's about 300 milligrams per serving. Most meats, fish, and poultry will have some phosphorus, pretty decent amount of phosphorus in as well. The egg yolk has quite a bit of phosphorus. Interestingly, white does not. So egg whites are kind of a freebie when it comes to phosphorus. Organ meats, especially liver, is where a lot of phosphate is stored. So it's going to be pretty high in phosphorus as well. In dairy foods and meats, the phosphorus is readily absorbable, so it will get into your bloodstream once it's digested fairly quickly. With regards to nuts and beans and seeds, these are high in phosphate as well, but the phosphate is actually bound to a chemical called phytase, and this reduces the bioavailability of the phosphorus in these foods. So depending on, again, how much, if you're watching your potassium, you might need to limit these because these foods tend to be high in potassium as well. However, you may be able to balance this out with the rest of your diet and have some beans and some lentils or some nuts depending on your need for potassium. So it can be a better source of protein, again, depending on the other factors in your diet. Whole grain cereals, bran cereals tend to be very high in phosphorus. Oatmeal can be high in phosphorus. So these could be added to your diet occasionally. Again, depending on the day and how you balance out everything else. What's interesting, when I was at a conference and I came upon this year, you can actually reduce the phosphorus in meats depending on how you cook it. So there was a study that looked at the different cooking types of how you would cook meat. So you could either boiling or steaming, frying, roasting, or stewing in oil, which really doesn't sound that appealing to me. But they found that the best method of reducing the phosphate in meats was, and other foods, was by boiling them. So what they found was a 51% reduction in vegetables, 48% reduction in legumes, and a 38% reduction in meat. And also, soaking meat for an hour in cold water also helps reduce the phosphate. So that might be a good idea if you're thinking of grilling some of your meats, to pre-soak it to help get some of the phosphates out of it. Some of the diet challenges we find, especially with phosphate, is food additives. And unfortunately, there are a lot of food additives that are put into foods by manufacturers. They're usually used as flavor enhancers. A lot of companies will put them in beverages, and they extend shelf life, improve texture. And the tricky thing is that it can be also listed as an artificial flavor, and they don't really have to tell you what chemical they're using. There's also no limit on how much phosphate additive they can use as a flavoring. So, for example, the other thing is you're not immune if you're using organic foods, because they do allow for some phosphate additives in organic foods as well. So it's important to check labels for these. But when we talk about artificial flavors, there are a lot of hidden phosphates in different beverages. And in the past, we used to focus on cola drinks as being the big culprit for phosphorus, because Coca-Cola and other drinks like it have phosphoric acid right on the label. So we know there's extra phosphates in it. But interestingly, things like fruit sodas and fruit punches, things like Hawaiian Punch, have almost as much phosphorus as a glass of milk, which is a little frightening. So you really need to be careful about drinking some of these fancy drinks that are available on the market. Iced teas, one wouldn't expect iced tea, you think it's tea, but because of the flavorings added to it, it can, again, get your phosphorus up to 189 milligrams. Energy drinks as well can be quite high in phosphate. And again, this is for a 12-ounce serving. Most of those cans of or bottles of drinks, those are up to 20 ounces. So you're actually getting even more than what's in these numbers. So you have to be really careful. Probably the best thing to drink would be water as opposed to those fancy drinks. The other thing that becomes a challenge is navigating food labels, because really only sodium is required on a food label. Now, there's all kinds of other things that companies may also list, and that's where phosphorus and potassium lies. Potassium you will occasionally see on a food label, but I don't recall ever seeing phosphorus on a food label. And here's an example of a food label that, again, we're lucky here. We get to see potassium on this, but it's very rare that you'll actually find it. Sodium is a requirement, so you'll always be able to tell what is on the food label, but the best way to know if there's potassium or phosphate additives is to really look at the ingredient list. Alrighty, so meal planning and shopping tips. So because there's multiple things to watch for in your diet, you really kind of have to pre-prepare and pre-plan what you're going to eat during the week, especially if you have a busy schedule and you don't have a lot of time to cook. So I'm not on a renal diet, for example, but I am on a gluten-free diet, and I have a lot of food allergies. So for me, eating out is a big challenge because I can't eat regular bread, and because of my food allergies, it's like, oh, I can't eat this and I can't eat that. So I have to kind of plan my week on the weekends in terms of bringing lunches to work and, planning for eating out and that kind of thing. So I try to prepare things and do my shopping on the weekends so I have stuff to eat during the week. Using renal-friendly websites for ideas. There are some websites that I'm going to list in a few minutes at the end, but typically you can find a lot of good recipe ideas online. Reading your labels. So one of the tricks that we teach in our clinic is scanning for PHOS, P-H-O-S. Typically, the higher it is on the ingredient list, the more it will have. And if it appears more than once on an ingredient list, you want to think twice, not think twice. And then you want to think about trying another product. For example, like fortified cereals tend to have a lot of phosphate additives, especially when it comes to their vitamin and mineral substitution, vitamin mineral supplementation, excuse me. So you may want to compare different brands of cereal because some might have more phosphate and some might have less. So just if you can get used to scanning your labels for that PHOS, it becomes a very good thing because the additives really can increase your blood phosphorus quite a bit. Potassium is listed as a preservative as well, so you can watch for potassium additives too. And again, the least processed the food is, the better you're off. Fresh is always your best option. And what do you do if you're eating out? This is a constant dilemma for me. I'll get back to me because gluten is everywhere and potassium is everywhere, and in restaurants, sodium is everywhere. So when you eat out in restaurants, there's going to be tons of sodium in the diet because usually cooks layer at each tasting, it's layered with salt. So anytime that you have a choice where you're in a restaurant and they can cook items to order, that's going to be your best bet. So you can request your food not have gravy on the side, or you can ask for things on the side or not on it, and ask your food to be made without salt entirely. You can have omelets made without salt, that kind of thing, certain breakfast items. When you're eating out in fast foods, you have to make your choice with fast foods. So you don't want to get the burger laden with cheese, and you don't want to, the French fries. That's going to be a no-no. Phosphorus, again, you can get your burger without cheese. For that will cut back your salt and your phosphorus. Mexican food, again, is it can be high in salt, it's high in cheese, it can be high in avocado, which is a high potassium and phosphorus food. So again, you have limited choice. You can still make choices, but you have to know your foods. Italian foods, lots of tomato sauce, lots of sodium, pizzas, that kind of thing is you have to watch for. Asian foods can be high. They use a lot of soy sauce in their foods. So again, you can ask for steamed rice instead of fried rice, those kinds of things. Kidney.org is a really good website in order to find some resources and ideas for eating out. It actually has some really good tips. So again, this doesn't look quite as attractive as, well, I don't know if this actually looks that attractive. The heart attack on a plate burger versus our lean burger with lettuce, and we have a slice of tomato and maybe some roasted bell pepper. It still gives you a lot of flavor, but much healthier choice than our item on the right here. So just to conclude, to wrap it up, the renal diet can be limiting and it can be challenging. The more you know about your diet, so the more you learn about it, you can be empowered to make better choices. Learning how to read labels can help you make better choices, and healthier diet will, early on, heart-healthy diet will maintain your overall health and will keep your kidneys healthy longer. Now, here are some resources for you. These are all have good resources as far as diet. This last resource is kind of my go-to. If you want to find out what is in any food, you can find it on this database. So I would encourage you to use that if you are so inclined. It will give you everything you want to know through the standard reference on particular foods. And I will wrap up there. So thank you for giving me your time.
Oh, thank you, Esther. I think it was so informative. I know I learned quite a bit, and I'm getting emails from people saying how helpful it has been. We have a couple of questions online. I see that there are also a couple of hands raised. So I'm going to go first to the online questions. If you have a question, you can enter it in the chat section here. And at the end, I will unmute the phone, so those of you who have your hands raised and prefer to ask your question directly can do so. The first question, what is the appropriate amount of protein intake for each stage of chronic kidney disease?
Okay, that protein is a more variable question, and it kind of depends on your weight, your height. That's a very individualized number. Typically, we don't encourage high protein diets with any type of kidney disease. if I'm thinking about my average size person who might weigh about 150 or so pounds, that person might need about, say, for example, 60 grams of protein a day. So what would that look like in a diet? Well, if your average chicken breast, which is about 3 or 4 ounces, that has about 28 grams of protein, or about half the amount of protein that you need in a whole day. Protein is also available in dairy foods. It's available in grains. It's available in vegetables and fruits, and not so much in fruits, but in vegetables as well. So there are lots of places to get protein, but again, eating a big old steak and the double burger is probably not the best choice in terms of eating protein. And when you probably need to balance it with other foods, vegetables, carbohydrates, in order for it to be utilized properly. So again, it's very individualized depending on your size. I hope that answers your question.
Thank you. When are bicarbonate supplements recommended?
So typically they're recommended depending on blood levels. So if you have a low bicarbonate level in your blood, your doctor will recommend a bicarbonate supplement for you. And those are typically available in pill form. Back in the good old days, doctors used to prescribe baking soda, which is kind of gnarly. I think the pills are a little easier tolerated. And again, that's individualized based on the amount of acid that's in your blood.
Great. I had someone ask a question before the presentation. They were not going to be able to attend. And you spoke a little bit to it about eating out, but they're concerned about college living, dorm living, eating off a meal plan, and or college apartment living maybe not being as conducive to the diet that you recommended. Are there any tips in terms of working within a meal plan at a college dorm beyond what you've shared with eating out that you can provide to young men who may be and women who may be facing this?
Well, I have, depending on the dorm and their resources, some dorms allow you to bring in some pre-prepared meals, depending on, again, the resources and how far away you live. Like if you're thousands of miles away from home, clearly you can't prepackaged food. I don't have that many college students going out of state. Most of them are close by. But when you're away from home, there are some college kitchens that will work with dietitians where they will help with special meals. It's more common in a high school setting than it is in a college setting, but there have been occasions where some of the college campuses have been amenable to special diets.
And you said that is common in high school as well.
Correct. For my high school students, there is a requirement if you have special dietary needs for if the patient's on a school lunch program, the school has to make accommodations. So we fill out forms for the school districts, and if they're providing lunches or breakfast, they have to accommodate within a specific sodium requirement and potassium requirement.
Great. So parents of students who are getting school lunches should contact their local.
They should either contact their pediatrician, or they should contact, if they have a dietitian. Most dietitians have access to the school forms. I do it with all my kids that are on special diets, even if they're just on sodium restriction. Yeah.
That's great. I think that's going to be very informative for a lot of parents. I'm going to unmute the lines now. I know we had a couple hands raised, but some of them went down. Maybe you answered their questions already. But if anybody has a question that they would like to ask over the phone.
The conference has been unmuted.
I just unmuted the lines, and so please know that you're here too. But also, if anybody has any questions, you can ask them now directly on the phone. All right. Well, I think that you must have answered all.
Okay.
If you have any further questions, for those of you who are watching this presentation not live, but are watching it after it was recorded, you can feel free to email questions to us at info@alportsyndrome.org, and we will make sure that your question is answered. Again, that's info@alportsyndrome.org. But for right now, I would just like to say thank you so much, Esther, for this presentation. This was incredibly informative, and I know it's going to be helpful for so many people.
I hope it is. And thank you again for the opportunity for letting me come to your group. And I'm happy to provide you, if you get any email correspondence, I'm happy to help out.
Wonderful. Thank you so much. We really appreciate it. Have a good rest of the day, everyone.
Thank you. Thanks, everyone.